I wasn't looking for information on water fasting originally. I was just interested in figuring out how health worked. I was actually motivated to become a better basketball player when I was a kid. I wanted to beat Dr. Lyle in basketball. He's our clinical psychologist now, and I grew up with him, and he just beat me mercifully. So I started reading, and I read a book by Herbert Shelton, and he said something that I thought was very interesting. He said that health was the result of healthful living, and that healthful living involved diet, sleep, and exercise. And he talked about this use of fasting to undo the consequences of dietary excess when things hadn't been followed properly. And it made a lot of sense, since most of the people that were sick from conditions of dietary excess. So obesity, diabetes, autoimmune diseases, many forms of cancer are intimately associated with dietary excess. It made sense that fasting might be useful at undoing whatever it was the dietary excess was causing. As I read more about it, it made much more sense. Unfortunately, it didn't help me beat Dr. Lyle. I'm 63 years old, so he still beats me mercilessly whenever we play basketball. So I'm hoping that maybe as we age out, we get into our 80s or something, maybe he'll age out a little quicker and eventually I'll be able to beat him. So even though it completely failed at helping me meet my goal, it got me very, very interested in this idea of how could you help people that were sick get well, and more importantly, perhaps, how can you help people that are healthy stay that way? So for the last 39 years, we've been operating Schumer Health Center. 21,000 people undergo fasting. And more recently, in the past 6 years, with formation of the Trump Health Foundation, we've been able to do some original research and are publishing increasing numbers of papers in the scientific literature about what actually happens to the body when it fasts and what happens to individuals with health conditions when they fast, and follow it with a whole plant food SOS-free diet. And I decided to try it for 50 years. And I thought that after 50 years, I'd have a pretty good idea whether it was working. So that was 46 years ago. So I still have a few more years before I determine whether it's effective, but so far it seems like it's working pretty well. It is interesting that virtually every religion, from the Jews to the Jains, the Hindus, the Muslims, the Christians, all have a tradition of fasting in their teaching. They may disagree on a lot of other things and sometimes kill each other in the street over their disagreements, but there's a uniformity of agreement that fasting has an important role, both for spiritual as well as physical means. Fasting changes how you feel about yourself and the world around you. You can't help it. Whatever your religious beliefs are, it seems to have an enhancing impact. Fasting itself is a biological adaptation. In other words, human beings had to be able to fast. Every human that didn't have the ability to fast died. It was a death sentence because modern humans have a huge brain, and it's our biggest burner of glucose. So we burn 2.5 times as much glucose, say, for example, as chimpanzees. And chimps, interestingly, don't fast. They don't have the ability to change their brain from burning their normal fuel, which is glucose, to burning an alternative fuel, which is fat, and in particularly beta-hydroxybutyric acid. Never wander away from the tropics, because if they did, the first time spring comes late, they'd all die, because they can only go about a week or so without eating, because if they go into gluconeogenesis, burn up their protein, and eventually succumb. Humans change our fuel from burning glucose to burning fat. And so a 155-pound male, a skinny male, could go as much as 70 days without eating. Now, if our brain didn't do that, if we couldn't fast, if we couldn't change from burning glucose to burning fat, we would only be able to go about a week. It's because of the ability to fast that we can go so long. And it was so critical for humans because our brain is so ridiculously large and it burns so much glucose that we had to have this ability. So the people that had that ability survived, the ones that didn't died. And now everybody, with a very rare exception, people, for example, with MCAD, medium chain acetocoenzyme A dehydrogenase deficiency, that's a genetic defect where they can't break down fatty acids, they would not be able to fast. So that's 1 in 10,000 people. So we test everybody, so we make sure we don't fast the wrong people. And that's an important thing to remember, is that not everybody at any given time is a good candidate for fasting. There are many people where fasting would actually be contraindicated, where it would do more harm than good. For example, if you're pregnant or lactating and you try to do a prolonged water fast, you're going to lose your milk production, not a good thing. If you have anorexia nervosa, which is actually a neurological condition where people want to fast, they perceive themselves as being very large even though they might be emaciated. Fasting is not for the treatment of anorexia nervosa. If you're a type 1 diabetic, not a type 2 diabetic, which is 95% of diabetics where they have insulin resistance and responds great to fasting, it reduces insulin resistance and normalizes blood sugar levels. But type 1 diabetics don't produce insulin. I mean, their pancreas has been destroyed by their body's immune system. And one of the triggers for that is, interestingly enough, drinking cow milk, a large part of what type 1 diabetes is thought to be from. So they wouldn't be able to fast because you need a certain amount of insulin in order to adapt to the fasting process. So without insulin production, it would be very difficult to fast. You'd be very vulnerable to ketoacidosis and you'd get into respiratory problems, and it's not a pretty picture. If you had a condition where they've had to use anticoagulant therapy, Coumadin or other medications are used commonly for these problems, you have to be very careful about fasting because you can't just arbitrarily discontinue those medications without increasing risk of stroke. You don't want to fast on those medications because many of these medications in general can be potentiated during fasting and create a lot of problems that they wouldn't create in the fed state. So that's people that have had like stroke, myocardial infarction, pulmonary embolism, DVT, something where you've had to be on anticoagulant therapy. Now those people can sometimes do modified versions of fasting that would allow them to safely continue, but it wouldn't be water-only fasting. If you've had a recent heart attack or stroke, again, sometimes that would indicate a use of anticoagulant therapy. If you have severe kidney disease where your creatinine levels are over, for example, 2.0, you wouldn't want to do a water-only fast because the detoxification that happens in fasting is largely done by the kidney. People think about the bowels, but the bowels really are a secondary source of detoxification. Think of when you put something in your mouth and it goes through the digestive system and eventually gets to the rectum and you push it out the other end. That's never been in the body. It only gets in the body if it gets absorbed through the intestinal mucosa. The bowels are not the main source of the toxins in your body getting out of your body. The way that happens is the stuff that's in the blood is processed by the kidney. It's eliminated in the urine. So it's important to realize you have to have a certain level of kidney function in order to safely be able to adapt to fasting. It's also why we wouldn't recommend, for example, dry fasting, where you're not consuming any water, because then you don't have a solute to put the toxins into and get it rid. And that will build up and eventually shut down your kidneys. And recently, the famous internet advocate of dry fasting that passed away, secondary to kidney failure, and kind of what happens if you overload the system. So we wouldn't recommend not getting adequate water intake, and you wouldn't recommend fasting in people that don't have adequate kidney function. So we measure everybody's function before we start fasting and monitor it during fasting to make sure that it's working properly and we don't end up with failure. There are genetic defects in rare people. We mentioned MCAD, that's 1 in 10,000 people, but those genetic defects, other things like porphyria or other things would be relative contraindications to fasting. If you have deficiency, depletion, or cachexia, fasting may not be for you because you have to have adequate nutrient reserves. Now it's true, the body recycles those during fasting, which is why you can go 40 days or longer without supplementation. You think, well, why wouldn't you develop deficiencies? It's because of the recycling efficiency in water-only fasting. If you're on medication, with rare exception, you have to be able to safely withdraw those medications before you would implement water-only fasting. And if you cannot rest, you should not fast. And people say, well, why? If you exercise, you'd lose more weight, wouldn't you? Yeah, you'd lose more weight, but it wouldn't be fat. It would be actual muscle and lean protein. What happens in fasting is the body goes into a conservation mechanism, but you still need a minimal amount of glucose. So if you increase your glucose needs by too much brain activity, too much muscle activity, the only place the body can get that extra glucose efficiently is through breakdown of protein. It will. And in fact, we've done a study to prove that. We actually took a DEXA scanner that allows you to do detailed whole body composition. So not just how much fat there is, but how much visceral fat there is, etc. And in this study, what we did is we monitored patients before, during, after fasting, actually at 6-week follow-up, and now we're getting 1-year follow-ups too, interestingly enough, and papers will be coming out this year. And what we discovered was that the body loses weight during fasting, about 1 pound a day. And it's composed of fat, including visceral fat, protein, fiber, glycogen, and water. And when you come off the fast, you regain weight. And what you regain is water, glycogen, fiber, and protein, but not fat. When applying a whole plant food SOS-free diet, the fat loss continues. The lean tissue recovers. And in this study that we'll be publishing this year, it actually shows the lean tissue mass of the individual on recovery is actually higher than it was when they started fasting. And that the fat not only went down during fasting, but it continued to go down all the way through recovery. And that visceral fat was preferentially mobilized during fasting at a higher ratio than anything else that's been shown, including keto diet and all the other kinds of stuff going on. That the ratio of visceral fat to adipose tissue is close to 3.0. What that means is that a person that might lose, say, for example, 20% of their adipose tissue, a 2-week fast, may lose as much as 50% of their visceral fat. And the 4% of lean tissue is recovered during repeating. And so the overall composition of the body changes when fasting is done properly. You still have to eat well. In order for that to happen, you can't go back to greasy, fatty, slimy, dead processed foods and expect that that's going to happen. But on a whole plant food diet, lean tissue recovers, hydration recovers, fat continues to lose down to optimum weight. Fasting reduces IGF-1, which is insulin growth factor 1. The lower your IGF-1 in general, the better off you are in terms of surviving. And there's two things we know that lower IGF-1 consistently. One is fasting and the other is exercise. The same biomarkers that change with exercise often change with fasting. And you might think, well, wait a second, that doesn't make sense. In fasting, you're saying you're resting. Exercise, you're vigorously active. Why would they both work on the same biomarker? And it's going to turn out that fasting and exercise have one very important thing in common, is they both undo the consequence of dietary effort. And so it's not surprising to find out that the biomarker changes that are benefited by exercise are also benefited by fasting. For example, leptin. Leptin goes down in fasting, and the lower your leptin level, the lower the inflammation in general. Blood pressure and heart rate levels go down with fasting. And ultimately, as a consequence of exercise, although during exercise, obviously, they go up. And what gives you the best diversity is a variety of plant-based foods. One of the reasons why these plant-based diets may enhance immunological function is because of the effect on the microbiome. And it's very, very important part of your immune system. In fact, if you take human beings and divide them into two piles, human cells and non-human cells, it turns out the pile of cells that's non-human is actually bigger than the pile of cells that's human. You're more non-human cells than human cells, which is kind of bizarre when you think about it. And so it's important that you feed those cells that are protecting you by their diversity the right food. And it turns out in fasting, there's a dramatic shift that happens with the microbiome in your body. And what happens is there's a big die-off, and then when you refeed properly after fasting, you get the big increasing diversity is the thought that happens. And a lot of these conditions associated with gut leakage and microbiome balance occur to heal during fasting and resolve and are better managed post-fasting. Now, we've actually done a study on this where we took stool samples before, after, and on long-term follow-up to look at this diversity. We did that with Luigi Fontana from Washington University. We don't have the results of that study yet, but we're waiting and we're very excited. We know clinically what happened. We don't have the numbers to cite yet. Other things that go down in fasting, perhaps one of the most powerful reductions in fasting is inflammation. And the way we know that isn't just because the pain goes away, because the biomarkers consistently, predictably go down during fasting. And actually, interestingly enough, if you follow it with a whole plant food diet, they stay down, which is why we probably see such dramatic results in autoimmunity and diseases like asthma, eczema, psoriasis. We believe that diet, sleep, and exercise that drive health. And as I mentioned, sometimes if you just do that diligently over enough time, you get well, whether you fast or you don't fast. But we believe everybody should fast every day for 12 to 16 hours and limit your feeding window to 8 to 12 hours. The reason there's a variance is if you're trying to gain weight, 8 hours of feeding may not be enough to get enough calories of this low-density food. If you're trying to lose weight, then 8 hours is plenty. You limit your feeding. But the point is that gives you a 12 to 16 hour fast every day. And even that brief amount of fasting may help undo some of the consequences of that. And then if you occasionally do a longer medically supervised fast, there may be additional benefit. And that's what our research is looking at now. I've been claiming that sick people get well, and that's all very nice. But I believe that healthy people that fast periodically may get additional benefit. And now I've got some data to actually support that. We looked at these biomarkers associated with inflammation and other things, and they go down and improve in people that are sick. But it turns out they also improve, in fact, even more so in healthy people. Some of the effects on healthy people are even more profound than on sick people, which isn't shocking because healthy people have a lot of vigor, and it's not surprising that they could do a lot in a short amount of time, and they do.